Hello, I'm Dr. Hilary Jones, a GP, a TV doctor, but most importantly, a patient who in the past has had low back pain myself. There are two different main types of pain. The first is neuropathic, in which case the pain is coming from the nerves, and the other type is called nociceptive, where it's tissue pain. And those two different types will lead to different kinds of symptoms. Firstly, in neuropathic pain, the symptoms would be electric shock-like symptoms, stabbing pains and burning. Whereas with the other type, people are more likely to describe achiness, stiffness, and perhaps tissue tenderness, muscle ligament tenderness itself. Of course, some people will have both, not necessarily at the same time, because the symptoms can evolve one into the other. Now, it's really important to describe to your doctor what type you've got. About 1 in 15 people will go and see their GP. And it's useful to be able to say to the GP what type of symptoms you're getting, because he's got no way of measuring your pain. What you need to be able to tell your doctor is the description of your symptoms. First of all, how long you've had the back pain, 10 years or 10 days, that's important. Then you need to say where it's located. Is it in the small, in the middle of the back, or does it go down into the buttock, down the back of the leg and into the foot? In other words, does it radiate anywhere else? Then, what brings it on? What makes it worse? And what makes it better? What's the worst it can get? Does it keep you awake at night, actually causing you pain during the night when you're not even moving? And what's the best it can ever be? These questions are important. And perhaps lastly, but by no means least, how severe is your pain? Again, the doctor can't measure it, so you need to tell them. Think of a scale of 0 to 10, when 10 is the worst pain you can possibly imagine and 0 is no pain at all. Somewhere on that scale, your pain will be. If you can indicate to the doctor, that's really helpful. Now remember that backs usually like movement. It's quite important to prevent stiffening and aching by getting up and moving around every now and again. So later in this series, called Pain and Simple, we'll be showing you how important movement is and what kinds of movements really benefit a bad back.